Hi, welcome to another episode of our weekly Get Real with Dana and Jenny. We're so excited to have you with us. I'm Dana Bowman, co-founder of Thyroid Refresh and Thyroid30.
And I'm Jenny Mahar, and we're so happy to be here with you guys today. We've been doing this Friday morning Facebook Live series. That's been really fun, where we just are, here talking about life with thyroid disease and, real talk about living well with thyroid disease and being thyroid patients. So today, Dana and I wanted to talk about, you know, progress, not perfection. You don't have to do it perfectly. Um, we're also going to be having a very special guest joining us soon, Adrienne Klein. She is our Thyroid Refresh team nutritionist. She's also known as the Thyroid Whisperer, and she's a transformational nutrition coach. So if any of you have questions about anything, thyroid nutrition related, let us know in the comments, and Adrienne will be able to look at those questions while we're chatting. So before we dig in, Dan, I wanted to talk a little bit with everybody about our exciting launch that's coming up for Thyroid30.
Absolutely. I'm so excited. I can't wait. The cart opens September 20th and our first wellness adventure begins October 7th. We cannot wait. If you don't have any information on it or you would like more, please check out our site, thyroidrefresh.com/thyroid30 to learn more. And you can get on the mailing list and you'll be dazzled by all of our emails that we send out.
And if just for the people who aren't familiar with it yet, Thyroid30 is a revolutionary new way to adopt and implement thyroid specific diet and lifestyle changes so that we can thrive together. We are so excited about this. It's going to be incredible. It is incredible. We've been doing it. We've tested it many times. And we are so excited to hopefully help a lot of people. So if you're interested in learning more, be sure and click sign up on our Facebook page so that you can join our mailing list and we can keep you in the loop with important news and updates. We'll let you know when the cart is opening because there is a limited enrollment window. So make sure you join our mailing list so that you can get all the news about that. Really, we're all about just helping thyroid patients achieve a higher quality of life. And, that's really what it comes down to, because we all want to enjoy our lives. We want to pursue our dreams. We want to feel like ourselves. We want to be the people we want to be and the parents we want to be and, enjoy all that life has to offer in spite of thyroid disease. And so many of us know that even with, proper treatment and medication, there are some residual symptoms. And, diet and lifestyle has made a huge difference for us and for so many other thyroid patients out there, that we really wanted to create what we needed as thyroid patients to support us on this path of, implementing and staying, on the kind of straight and narrow with those diet and lifestyle changes so that we can feel well.
And let's be real, because it's not easy. It's just not easy. It is one of those things that, unless you're in it, you don't really understand. So, it's one of those things where, every day is different. You can try to plan and you can do your best, but every day is different. You don't ever know really what's going to come at you. And there's also so many kind of caveats and little, different things that affect your thyroid and have to do, it's all connected, in other words. So my adrenals, for one, are a big issue for me, and that's connected to thyroid. And your gut health, so connected. There's so many things, and we really didn't want anybody, or we wanted to try to help people not be overwhelmed. And that's really such a big thing for me because I was overwhelmed for so many years. And so with Thyroid30, we try to take the thinking and all of that out of it for you so you can just follow along, play the game, get support with some people, friends, colleagues, whatever, and go on the journey together. And, we're really proud, really excited to bring it to you, but it's not easy. And so we're hoping, we know that this is going to make a big difference for lots of people. We're really excited.
That's so true. And I think, it should be fun. And we thought a lot about how to make this more fun and simpler for people. You
Yeah,
know,
definitely.
if you're willing to put in a little bit of effort and show up every day, you can make major changes. And I say that from experience. I mean, I really spent 4 years tired every day, sick, so sick for months at a time. I mean, I got every virus that went around. I didn't feel well. I had terrible brain fog. And literally within like a couple months of making these discoveries about the power of diet and lifestyle changes, I 100% got my life back. I've lowered my antibodies by over half. Every time I test, they continue to go down since I've adopted these diet and lifestyle changes. Like, I mean, we can talk about a lot of the diet stuff when our team nutritionist Adrienne Klein joins us here in just a minute or two. But things like self-care, finding support, getting enough sleep, going to bed on time every night.
Sleep.
Yeah,
Sleep. So
exactly.
big for me. It was one of those things I didn't realize. That was kind of one of the things my functional medicine doctor, first thing he said to me was, how's your sleep? And I'm like, well, it's okay. And he says, well, define exactly what you mean by okay. And I did. And basically it wasn't okay. And I didn't realize. I mean, I think you kind of take it for granted, or people haven't put enough emphasis on sleep. I mean, yeah, you're supposed to get enough sleep, but uninterrupted sleep, you know, um, going to bed at a good time, also trying to go to bed without electronics, trying to keep a smooth um, plan, system, ritual for going to bed at the same time every night, because your circadian rhythm is so affected by everything, getting enough melatonin in the morning, waking up and getting some sun. It was such a big thing. And I didn't even realize. I just, who knew? I mean, they say sleep, or, sitting is the new smoking, or sleeping is the, I mean, I had no idea. So once I started paying attention to my sleep and really giving it kind of the, you know, what's the word I'm looking for? The attention that
Yeah.
it deserved, it
And that's
really helped me
really,
as well. It did. It helped me feel better.
and isn't that what it's about? It's about bringing more attention to our habits, but there's so many habits, like it's really hard to maintain attention to all those habits every day that support us, as thyroid patients and just people who want to feel good and live well and be healthy. I mean, every single day, can I think about gut repair, detox, sleep, how I eat, am I getting enough exercise? There's all these things. And so we sort of put them all in one place. We created a game with, teammates, rewards, badges, all kinds of fun, accountability, and motivation so that you can implement these things and make progress towards better health. We're not trying to replace your doctor's advice. We're here to help you implement those expert recommendations. So we're really, people can tailor their experience to whatever protocol or program they're working on. And we're really just here to create that support system.
And to tell people that it's not about perfection. There's no way. I mean, I know there's a lot of perfectionists that have Hashimoto's. We're driven people, but it's not about perfection. It's about taking steps and making progress. And that's the truth. And we're here to support you along that journey so that you can actually feel that. It's one thing to say it, but it's another thing to feel it and feel the support of someone saying, yeah, and it's okay. If you stayed in bed all day, you stayed in bed all day. I mean, there's no judgment. Everyone's welcome. So we really created it to be, user friendly, and where you could connect with people, but also so that you would feel so comfortable and happy and like you're having fun while you were doing this. Basically, as Jenny said earlier, Thyroid 30 is a 30-day wellness adventure, and it's dedicated to helping thyroid patients achieve a higher quality of life through diet and lifestyle practices. And people keep asking, well, how do you play? For 30 days, you and your teammates track your score among 8 different areas of thyroid healthy living, and we call these the 8 daily rituals. So that's basically it. You get points, you get rewards for doing certain things, and you track it all online, and it's fun. We're getting some great feedback. It's really fun. That's what I wanted, didn't you?
Absolutely. And I think, just I wanted to create something that would help motivate me and keep me inspired. That's so much of a part of this and of this lifelong journey for so many of us. I mean, I'm pretty sure at this point that this is probably my hypothyroidism and Hashimoto's is probably going to be lifelong for me. It's been 7 years now, and that's the case for a lot of us. So this should be something that we look forward to checking in with every day. And I think one of the big pitfalls for that people run into is trying to do it perfectly and feeling overwhelmed. Oh, I
Mm-hmm.
have to do this, this, and this, and I want to feel better. And I'm at maybe I'm at my breaking point or my rock bottom or whatever. For whatever reason, I'm motivated to make change, but now I'm overwhelmed by all that I'm supposed to be doing. I
Yep.
can't stay on the path, and I screwed up and ate a donut today, so it's ruined. I give up. And
Right.
I think that's something that, we really tried to incorporate into our support system, and also that you and I talk about a lot just as thyroid patients is just, it doesn't have, you don't have to do it perfectly. The important thing is every single day showing up again and again and continuing to try, because it does matter. It does make a difference. Like
It does matter.
we were just talking about this with our friend Kaz, Dana, who was saying, she goes to hot yoga, and the instructors say, when you get overheated, don't leave the room.
That's right.
And that's kind of it, isn't it? Don't leave the room. Don't give up. Don't throw up your hands and say, I quit. At least stay in the room. Show up again. Try again the next day. Figure out what derailed you and see if you can, tweak that a little bit. Maybe focus, instead of focusing on everything at the same time, focus on one primary goal so that you can not overwhelm yourself and increase your likelihood of success so you can feel better.
Yeah, not leaving the room. I mean, it's such a simple and fun analogy to use, but truly that's it because, I think we've all kind of been set up to think that, okay, we have to, Monday, we're going to start our whatever, our routine, our diet, whatever it is. And, if you fall off 5 days in by, having the donut or having a glass of wine or whatever it is, instead of taking yourself to the extreme and out of the room or out of it and be like, okay, that's it. I'll have to start over again another day. You don't have to do that. In fact, please don't leave the room. Stay in the room and, how about practice your breathing? You're in the back and you're sitting down and you're in the hot room. You sit down and you're overwhelmed and you can't do all the stuff everybody else is doing. Fine. Start practicing your breathing. Close your eyes. Have some silence, some quiet time for yourself. I think we're really set up to believe that the only way we can be successful is to start on this Monday and go for however many days and not mess up. And that's just not the truth. That's just not the truth. So that's, it's really not about perfection, and it's really just about staying in the room and one foot in front of the other, baby steps.
Right. And it's about, having that forgiveness and compassion for yourself too. I mean, there are days when it's like, look, this is all I can do today. I might not get a workout in. I might not, maybe I made a bad food choice for some reason. Um, you know, you gotta just, I think it's like a big mindset
It
shift for a
is.
lot of people, where it's not so much about someday I'm going to be this way and I'm going to feel better because, that when this happens, then this will happen. It's more of like this is my everyday, and this is my new normal. These are the things I have to think about every day to stay healthy. As a thyroid patient, as an autoimmune patient who doesn't want to get more autoimmune diseases, who wants to stay healthy, who wants to play with my son and, live a full life and pursue my dreams. This is it's not a fad diet. It's not a temporary fix. This is an everyday lifestyle. And, really that's why we created not just Thyroid30, our wellness adventure, but also Thyroid Refresh. Those two things come together like puzzle pieces to really create ongoing year-round support for thyroid patients. Because as thyroid patients ourselves, we saw and felt that need. We had the need. We created what we needed for us to thrive. So we're so excited to share that with you. I see
Yeah.
that Adrian's here. Hi,
Yeah.
Adrian.
Hi.
Are we able to bring her on?
It doesn't look like it.
Oh no, you're kidding.
I don't
Oh,
know. Yeah. Yeah, we'll have to do some more research. I did, and I believe I'd seen it before, but I don't know. Be Live. Can we have 3 people on at once? I think we can. Anybody, if you know, message in the comments. But one thing I was going to say, to a point you mentioned earlier, was there's this like OCD level of, um, you know, impact and whatever that you put on yourself. Like, I have to do it perfectly, or I have to do it this way every day in order to get my results. In other words, I'm going to start taking the stairs, 1 flight up every day when I get to work instead of taking the elevator. And then the one day that you don't, you're like, okay, that's it. It's over. I screwed up. So now I'm just going to take the elevator every day. Don't take the elevator every day. Go back to it. If you mess up 3 days in a row, 5 days in a row, that's okay. It's this mindset that we have to start and keep going, and we can't have any mess ups along the way. And that's where Thyroid30 and Thyroid Refresh and Jenny and I come in, because we really want to hold your hand and say, you just got to do it the next day. You just got to, if you didn't do it that day, it didn't mess anything up. It's a mindset. It didn't mess anything up. It just made you feel something in the moment. But keep going. Stay in the room, because you can take the stairs the next day and the next day and the next day. Or maybe one day, you're trying to say every day I'm going to walk to the mailbox, or I'm going to walk 5 miles, whatever it is. If you don't do it one day, it's okay. It's really okay. Because what'll happen is then you take yourself out of the mix. Then you're just sitting for you're waiting for your next start time. And you could have been taking the flight of stairs, going to the mailbox, running your 5 miles, whatever it was you decided to do. You could have been doing that intermittently even until your next start day that you've set in your mind. So it's really just, it is a mindset.
Yeah. The someday mindset isn't like always the most helpful thing. It's like someday is now.
Yeah.
Someday is now, right now. You want to feel better, start right now. There are so many little things we can do to support ourselves, to care for ourselves as best as we can. For those of you who are just tuning in, Dana and I are here talking about, the thyroid lifestyle, and that you don't have to do it perfectly. And we also are sharing about Thyroid30, our upcoming wellness adventure that is launching this month. Enrollment opens September 20th. Okay, it's going to be a limited enrollment time. So you're going to want to stay tuned for updates about when that enrollment is going to be opening and closing. It opens September 20th, and our wellness adventure begins October 7th. The best way to stay in the loop is to join our mailing list. You can just click sign up here on our Facebook page. You can also go to thyroidrefresh.com/thyroid30 to learn more. But I wanted to get back to something you were talking about, Dana, with, not feeling like we have to do everything perfectly all the time. I know for me, there have been times when my whole life, morning to night, has been about healing and caring for myself and getting better. And that was a necessary part of my process. When I was, I had hit rock bottom, I was like, I am done. This is not working for me. I am so sick and tired. I'm not the person I want to be, and something has to change. And I was really ready to make that change. And I mean, I dove into the research. I read all the books. I still am always doing that, but it really became a huge focus of my life. I found a naturopath who 100% changed my life and my health. And I have been relatively way, way, way healthier ever since. I don't think I've taken one round of antibiotics, for example, since I started working with her. But anyway, there was that time when, I was doing strict autoimmune protocol. I was identifying food sensitivities. It really was a huge part of my life. And then there was a point where I had to say, okay, that was really hard. And I'm kind of, I'm ready to sort of get back to a more long-term lifestyle for me. And so then, kind of pare back a little bit and go, well, I can get away with a little bit of nightshades, or I've been reintroducing this or that to my life. It's really about where you're at on the path and tailoring your experience to what works for you right now. It's not a cookie cutter, there's no cookie cutter solution. We're not cookie cutter patients. We all have different circumstances. We're all in different places. So, that really determines how we approach this lifestyle. I
Yeah.
see we've
And
got
but
Derek
Derek,
here from Gibraltar. Hi, Derek.
yeah. Hi, Derek. Nice to
Um,
see you. Thanks for joining us. Um, yeah, I think Marie's here too. Where are you from, Marie? Or where are you at right now? I know you're there. I can see you. Um, anyway, yeah, I mean, for me, lifestyle and diet, it seemed like this overwhelming, scary thing to start doing. And it really isn't, especially if you just start with one thing like, okay, I'm going to work on my movement. I'm going to work on my reactivate, the 1R. I'm going to work on one of those. I'm going to, every day, I'm going to stretch and, do a couple down dogs and whatever it is that you can do. If it's running 5 miles or if it's going to a hot yoga class or, whatever it is for you, but really just, setting that something that's attainable, something that's achievable for you and just kind of sticking with it. And once I did that, and I let myself falter and I let myself have those days where I didn't do it. Like last night, we didn't get to walk as long as we normally do because it started raining. Oh well, just okay. If I really wanted to get that time in because I'd been doing it every day in a row and I was feeling really good, good with that. I was like, okay, look how I'm doing. This is really good. And then we had to cut it short last night, and I was like, oh, but that's okay. We still went. And diet and lifestyle really have so much to do with it. That's one of the things Jenny and I like to say is there's so many people out there, so many websites, so many doctors, so many experts that we all love and appreciate. Then they give you the what to do, but we give you the how to do it and hold your hand while you're doing it. And we are so excited to have you join us on this wellness adventure because it is going to be fun. It is going to be easy, and you're going to feel supported. I know there's a lot of people out there that don't have, some great support. I have amazing support from my husband, thank goodness. But I know there's a ton of people. It breaks up marriages, all kinds of scary stuff. So, the support is a really big factor. So joining a team and hanging out with your teammates, and it's going to be really, really neat. So again, Thyroid 30 Wellness Adventure, 30 days of fun. The cart opens on September 20th, and the game actually starts October 7th. So we are over the moon excited and so glad all of you joined us today.
We are. And, one thing Dana and I always talk about is that support and how, even if you have supported family members or friends, people, close to you, it's so nice to have other thyroid patients who get it, who know what it's like, the good days and the bad days, the ups and the downs, the constant navigating of okay, something's a little bit off now, and what could it be, and how can I better support myself, and how are my daily choices affecting how I feel right now? Am I, making like stress management a priority? Am I making my gut health a priority? Am I making my bedtime a priority? Things like that. So Thyroid 30 really puts all of those things into one, under one roof and into one thing. Adrian says, plus you can be on my team. That's right.
Uh-huh.
Oh,
Uh-huh. She's already trying to recruit people. Uh-huh. That's not fair. Uh-huh. My team, head bandanas. That's it. It's
well,
gonna be the
yeah, that's Dana's team, the head bandanas. I mean, this is a really cool part of the system. So different, healthcare practitioners, nutritionists like Adrian can create their own teams. Those teams can be open to the public or they can be private. And so you can come and play with, these people as your team captain, and they're going to be there cheering you along, guiding you through, in addition to your other teammates. You check in with your teammates every day. That's part of your score. And we really encourage that engagement and that community support. That is the most fun part of it. And it's what makes you look forward to checking in with Thyroid 30 and filling out your scorecard every day, is those other people who are like, I am on this path right alongside you. It is incredible what we're capable in our lives when we have that kind of support. It's really amazing. And I think it's such a gift to give that to ourselves. So we are really
And you know
excited to
me, I'm
share this.
all about cheerleading. So I'm here to support you and make you feel better and yay in the background, pat you on the back, even for little things, those are still big moments. Small victories are victories. So yeah, so we're really excited. Thank you so very much for joining us today or on the replay. Thank you for those watching the replay. I'm Dana Bowman, co-founder, along with Jenny Mahar, and we are so glad to have you. And we can't wait to see you in Thyroid 30.
Thanks for joining us today, guys.
Bye.